Hi everyone, I'm Dr. Shantanu Gulati, cataract surgeon, and today I'll be walking you through a tough case that I did which involved a very severe central corneal opacity, and we'll be talking about some of the things that I've learned over time. So the first thing is that I suggest you always take a brittle suture in such a case because it's always better to have it and not need it than the other way around. The second thing, as you can see, is that you should always initiate a rhexis from the clear part of the cornea, because in a case like this you never want to lose sight of the rhexis margin. Each step is critical, and no matter how much time it takes, you have to ensure that you do it perfectly. So I stopped doing my rhexis from the side port and then I move on to construct my main port. The reason is that because I found that I am more comfortable making a larger rhexis with Haldipurkar forceps than with a cystitome, especially when the visibility is poor. So I start making my main wound, and you go very slowly and you ensure a very good scleral wound. So you take your time, you bury through the sclera, and now you move on to making your entry. Now my third tip for you is that when you make your main entry incision, you make it a little bit larger than your standard 2.8 millimeters, because in a case where visibility is poor, maneuverability becomes more important than visco loss from the anterior chamber. You can always fill in visco again, but that little bit space that you get, that really helps in making your rhexis. Another thing I would like to talk about is your surgical numbers during training. Now, contrary to what most training places will tell you, I believe that number of cases is of utmost importance, especially if you want to go into private practice, because it is always better to have faced all sorts of difficult situations during your training period so that you are equipped to handle them when you are alone and there is no one to help you if you get into a sticky situation. Now we move on to hydroprolapse. A very gentle hydro is done and the nucleus is tilted out of the bag and it comes out, and at this point you inject visco under it and you push it a little bit to the back. Now this is again very important because you want to create a space between the nucleus and the posterior capsule as you will be going in with the vectis. You go in with the vectis, you ensure you see the margin of the vectis, and then you take the nucleus out. Now I'll fill the bag with the visco and I'll now be going in with my Simcoe cannula. Now my next tip for you is that in any case what I've seen is that when you enter with the Simcoe cannula, it is always better if you have some amount of fluid that you can flush into the anterior chamber. What this does is that it clears the sticky cortex that is stuck to the cornea, and it provides much better visibility for your cortical cleanup. As we all know, it's always better to use the side port and ensure that your cortical cleanup is very gentle. You want to see where you're holding the cortex, there's no need to hurry, and you always want to catch the anterior lip of the cortex, which is at the plane of the anterior capsule. When you're entering from the main port, always push the main port upwards. That actually creates a seal and it forms the anterior chamber so that you can go ahead and use your main port for cortical cleanup. Another tip I would like to add that I've learned is it's always better that once you have caught hold of the cortex, instead of aspirating it, you pull your Simcoe cannula behind ever so gently. It provides you much finer control than actually just going ahead and aspirating, because that is a very blunt movement, and if you catch the bag, it is very difficult to stop. So instead of aspirating, just catch hold of the cortex and pull your Simcoe cannula out. Another thing I'd like to tell you is a little bit controversial, but in my place of work, they allow us to use both plastic and glass syringes. And what I have found is that, in my personal opinion, glass syringes provide much better control and much finer control compared to a plastic syringe. So just like that, the IOL is rotated inside the bag and the surgery is done. So basically, My main pearl for you today is that slow is actually fast. Whenever you are doing a tough case, just be slow and make sure that you do each step as best you can. You don't want to add to your difficulties. So these were my tips in Learn with the Learner series on how to do a case with central corneal opacity successfully. Feel free to share your opinions on such cases in the comment section. Thank you for watching.